You're listening to the La Jolla Cosmetic Podcast with Monique Ramsey.
Deciding to get any cosmetic procedure is a big deal, but especially when it comes to your face. A big part of helping patients feel comfortable, confident, and well prepared ahead of time is giving them a visualization of what their final results might look like. Dr. Kiersten Riedler is here with us today, and she takes her time during each of her rhinoplasty consultations to create a photo simulation of a patient's before image. What their goals are to make sure that they're seeing eye to eye with what she's seeing, and is their goal possible? Because maybe their goal isn't. And so it's a good tool for communication. And so welcome back, Dr. Riedler.
Thanks for having me.
So tell us about why showing rhinoplasty patients an idea of what they might look like with their final results so important, and how does it help with expectations?
So I think it's really important because rhinoplasty is very personal and three-dimensional surgery, and everybody's nose is so different. There are sort of ideal ranges in terms of angles, dimensions, proportions. However, that's a range. And, just because I think it's not about what nose I want you to have, it's about what nose you want to have. Mm-hmm. And so it's really a great communication tool.
Do you do this at every rhinoplasty consultation?
Yeah, I do. Because everybody's anatomy is so different, and I can talk all day about all the different little anatomical details and parts of the nose, but I don't expect patients to know any of those terms. So it's sort of like a picture is worth 1,000 words.
Yeah, because I think sometimes patients don't know how to verbalize what it is they want to see, but they can point to a screen. And if they see a picture of themselves, they can go right here. This is what's bothering me.
Exactly.
And now, what kind of reactions do you get from patients when they first see that simulation?
I mean, a lot of times patients are excited and they're like, oh, that's exactly what I wanted. Or that's exactly what I had in mind. That's not always the case. Sometimes they're like, whoa, it's weird to see myself with a different nose. That's going to take a little getting used to. Those are the two most common reactions, but everyone's different.
Now, what questions do you ask, and what specific features are you looking at during that consultation to make sure that you're creating an accurate image of what the patients are looking for?
The things that I really ask patients to give me an idea of what they're looking for is what bothers them when they look in the mirror, when they see themselves in photos. Is it a bump? Is it a crookedness? Is it that the tip droops, especially when you smile? Things like that. And then also just looking at the rest of the face, how the nose balances with the rest of the face, and also the skin thickness, the septum, it's all interrelated. But for as far as what the patient's goals and what I'm asking them, it's more about what bothers you, why are you here? Essentially.
And how accurate would you say your photo simulations tend to be when compared to the final result?
I think they're pretty accurate, but the goal isn't for them to be 100%, accurate. It's not a guarantee. It's more this is a roadmap. This is what I'm going to, look at in the OR and try to create as closely to the simulation as I can. I think in my hands are usually probably around 90% accurate if I could put a number on it, but healing can be unpredictable. And in the beginning, you're swollen. So it takes a little while to get to that final result. But
yeah,
the reason I like to take the photos myself and do the morphs myself is because I know what I can do working with your anatomy. So it's kind of helpful for me too, it's sort of the first or second time I'm going through her whole surgical process in my head for that patient.
Yeah. Well, and way back when Dr. Alastin was practicing in our office, I would do all the imaging for him. So we'd take the pictures and he would say, okay, Monique, now, rotate the tip. And, he would kind of point and I would execute, and he would go off, see a patient, come back when we're ready. And patients would say, oh, well, can you do, I'm like, look, I I can do anything on this picture. That doesn't mean he can do it in the OR.
Exactly.
And so I think cutting out the middleman and having you do it from the get-go is really good. I mean, you could have somebody else do it for you. It only matters what the doctor feels that they can do.
Yeah, that's true. I'm sure you were great at it, but
well, I was pretty good at it, but
right.
it helped me. It was really interesting because it helped me look at people's faces in a new way.
Mm-hmm.
And I think I also was able to see patients be able to make that communication better with the doctor. And I remember one man in particular, and he thought he wanted a chin implant. He kept talking about a chin implant. So I'm doing the imaging and I'm like, I'm pulling out the chin and I'm like, this is just, he doesn't need it. Like, I'm so confused. And finally, when Dr. Alastin came back in, we just knew something wasn't right. And so he said, show me where you want to look better. And really what the guy wanted, he had an older brother that had a strong jawline.
Oh.
The patient was saying chin. He meant jawline. And so what if we never had that imaging?
Yeah.
Would a chin implant go in? So it's a really good tool because we don't know what we call a chin is a chin or is it the parts around near the chin,
Exactly.
and so in his case, it really was a helpful tool to help understand and with the doctor to understand because they had already had a whole consultation by the time they came to image. So it still was like not talking the same language. So I think that tool, and I think the tool in your hands, like that cutting out the middleman part is great. So how long does it typically take you? Like, what would I be doing while you're doing this morphing of my profile? How long does that process take?
Yeah, so it takes about 10 to 15 minutes. I'll take the photos, upload them, and then modify the photos, print them out, bring them back to show the patient, and kind of go over them. And in the meantime, during that 10 or 15 minutes or so, usually I have my nurse or medical assistant going through some of the before and after photos in the gallery in the room so that the patient can kind of see other patients' results and kind of like get an idea of what to possibly expect.
Yeah. And I think knowing that what we have in our gallery online is different than what we have in our gallery when you come in to visit. Some patients don't want to be out on the interwebs. They're like, yeah, I'll share my result, but with patients in the clinic. Now, let's say if somebody was disappointed in, let's see, they see the imaging that you've done, the morphing, and they want a more dramatic result, but that might not be possible. Like, how do you approach managing their expectations?
So I kind of talk about like, what are the things that I can change and what are the things that are just things that I just can't change. I can't change where your nose attaches to your face, for example. I can't change your skin thickness. I also want you to be able to breathe. And
kind of important.
Yeah. And I want you to have a good long-term result. So just kind of explaining what is achievable, what is possible, and also going to give them good function.
Right.
Is, important. And that's one reason why I think this process is so important, because it isn't just to like confirm that we're on the same page. It's also to show patients what is possible, what is realistic with their nose, and also talk about like the function, like the long-term aspect of it, because I want to give you a nose that is going to like look good and breathe well for your whole life.
I'm going to just throw this out there and guess that because we have all these different AI assisted filters and all these apps, and you can do anything to your face. And then people start to have a new reality of faces, of beauty, of, how often would you say patients are referencing when they come in and they'll show you, oh, I did this to my face. It's one thing to use makeup to draw, to make the nose thinner or to emphasize cheekbones or whatever. But when you're actually using Facetune and it's become a whole different you, and you get used to seeing that. Are people bringing that in and saying, oh, this is what I want to look like?
Yeah, definitely. Sometimes, patients will like show me a filter or like Facetune, and it's helpful because it shows me what they do like. It's also actually helpful because that gives me an opportunity to show them what in that photo is like physically possible and what is not. For example, often I'll notice that like the nose is a lot narrower, but that's because the point where the nose meets the face is narrower, and you can't change. I can't give you like more cheek skin. Like I can't, there's certain things I can't like, just, I physically can't do, even if that photo isn't like possible surgically. That can still be like a good, communication tool, because that gives me the opportunity to say like, that looks gorgeous. And I wish I could do that, but I can't achieve all of those things that you're seeing like in Facetune or in filters.
Now, do you think patients having an image of a potential after sort of helps play a role in calming pre-surgical jitters, or I don't know, maybe even after surgery, having the long, while they're going through all the swelling and, having the long-term, like, okay, here's my goal and I will get there eventually.
Yeah, definitely. Because you're putting your face in somebody else's hands, which is a big deal. And so making sure that you're on the same page and you and then your surgeon have the same goals and, the same understanding, I think is really important and comforting. And then, it gives all them confidence also that they will look like themselves, just, a better version of themselves, but they're not going to look, like a completely different person who's unrecognizable or, has features that are totally off from what they were hoping to achieve.
Yeah. And I think also seeing the imaging or the morphine or whatever you want to call it is helpful. Does it maybe help let their brain
like
assimilate?
Relax, sort of.
Right. And even, I don't know, like there is something that happens to your brain a little, I would think after surgery, like your brain has to get used to seeing a new you, right? And there's got to be some time for it to connect, right? And so it seems like if you were able to pre-think about this new look, maybe it helps afterwards.
I definitely agree. I mean, I think it still takes a little getting used to. Sometimes when I'll show people the simulated photo, they're like, oh, wow, like I really like it, but it's kind of weird to see myself looking different. And so it helps your brain kind of like wrap your mind around that a little bit sooner.
Right.
And kind of like mentally prepare a little bit too.
Well, thank you, Dr. Riedler, for coming on the podcast. It's been a little while since we saw you, and I want to see you more. Yes, this is really fun. And thanks, everybody who's listening out there or watching us on YouTube. We love it. And if you come into the office and you show that you're a podcast subscriber, we're going to give you $25 off of any purchase of $50 or more with our skincare. And we have Alastin skincare. Dr. Riedler, if you were going to use your $25 off, what's your favorite Alastin skincare product?
Oh my gosh, that's so hard.
They're all good, right?
I really like the Restorative Skin Complex if I had to choose one. It's a great serum that is anti-aging. It helps moisture. It really just improves like your skin quality in a lot of different ways. So if I had to choose one, then I would do that. But
that's all we're going to let you do. Well, thanks, Dr. Riedler, and thanks everybody for listening, and we'll see you on the next one. Bye.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code PODCAST to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Zymed building on the Scripps Memorial Hospital campus. To learn more, go to ljcsc.com or follow the team on Instagram at ljcsc. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.